guys, it's Alice here. I am a doula, a childbirth educator, and I like to bring a little nugget of childbirth education in kind of a game show format, the Big Wheel of Birth. So let's spin and see what we're going to talk about today. Okay, today we've got something called Pitocin. So Pitocin is a form of artificial oxytocin. So just let me take a quick aside and talk about oxytocin. Oxytocin is the hormone in our body that causes contractions. Sometimes you hear it called the love hormone because it's released really in settings where we feel affectionate, where we are having close physical moments with our loved ones, and it's also the hormone that controls and regulates contractions of the uterus. So what happens in labor is oxytocin is produced, and it usually is increased. One way that the oxytocin increases in our body is as the cervix dilates. The dilation of the cervix can increase production of and transmittance of oxytocin. So oxytocin is a really important hormone to keep labor going. Now, Pitocin was created as an artificial version of oxytocin. So Pitocin is used for a couple different reasons in regards to childbirth. So the first one would be to induce labor. So Pitocin, when it is used to induce labor, it is diluted with regular IV fluids. So it is delivered in a bag of fluids, and it's delivered via IV. And the way that care providers use Pitocin is it is delivered in a method that's called, it's titrated for us. So what that means, if you ever had any science class or chem class in college, you might have heard that word titration. But what it is it's giving the Pitocin in small amounts and increasing the dosage until it has the desired effects on our body. And so it really depends on your care provider on what kind of contraction pattern they are hoping for as far as increasing that Pitocin. But generally it is increased about every 30 minutes or so. Again, this really depends on your care provider and your circumstance. But it starts out at a low dose and it's increased. And when you are on Pitocin, when your body's getting Pitocin, the fetal heart rate monitor and contraction monitor are definitely watched closely to make sure that the baby's tolerating the Pitocin, the artificial oxytocin, and that the contractions are at a place that they want them, a pattern that they want. And then once your body picks up on the Pitocin and labor is induced, a lot of times they stop increasing it because they found the level of Pitocin that's just right. Now sometimes as labor goes on, they might have to do some adjustments up or down depending upon what's going on. So that is one way that Pitocin is used during childbirth. The other way is similar, also delivered via IV, and that would be to augment labor. So if you go into labor on your own, unlike the induction where your labor is starting, but with augmentation is when your care providers would give you Pitocin to make your contractions either stronger, closer together, or longer, or more effective. So that would be a labor maybe that's not building up and strengthening and having the same amount of change on your cervix. A lot of times this is done if labor has been kind of slowed down as a result of getting an epidural. Sometimes getting an epidural can slow down labor, and then Pitocin is given to augment a labor that was already there. Again, it's also added in a slow fashion and increased until the perfect contraction pattern is found. So a second way Pitocin is used. A third way that Pitocin can be used in regards to labor is after the birth of the baby. and after the placenta is delivered. Many care providers will give postpartum Pitocin, so put Pitocin after the birth, and that is as a preventative measure to prevent postpartum hemorrhage and to help your uterus clamp down over that open wound where your placenta was. The uterus has to clamp down and control bleeding that way. And so postpartum hemorrhage, some care providers will give that via IV as well in order to prevent that, or to try and prevent that from happening. Like I said, it's really your circumstance and your care provider, how and when, if you have options on whether or not those are used, whether you have options to induce, how to induce, if you have options to augment your labor, or if you're going to need postpartum Pitocin. The fourth way that Pitocin can be used is also postpartum, and it's also the same role as the IV Pitocin in order to help your uterus clamp down, and this would be Pitocin given via shot, which is called IN, intramuscular Pitocin, and it's delivered usually in your thigh into a muscle, and that is the purpose of it, to help your uterus clamp down and prevent that postpartum bleeding, postpartum hemorrhage. So Pitocin is an artificial oxytocin. There are a few ways that it's used in labor, and I hope that you found this helpful. If you did, please hit the like button. Let me know that you're out there watching. It certainly helps. Also, comments. I'm always love to see comments and get any discussion going, questions you have or experiences you want to share with Pitocin, how Pitocin, if you've had any experience with it yourself. So hit subscribe and the notification bell if you want to be notified next time we do a big wheel of spin. And on the screen you'll see some other options, other videos that we've done on the wheel that are our most popular ones. So check one of those out. Go ahead, I'll see you over there. Bye guys.